You are listening to Wellness Prescribed with Fisher-Titus Medical Center. And today we are speaking with Jen Oakley-Swartz, physical therapist and manager of rehabilitation for Fisher-Titus Medical Center. So thank you so much for taking the time to chat with us today.
Thanks for letting me be here.
So it is a new year. I know a lot of people have resolutions to get healthy and lose weight, and start exercising is a big part of that. So tell us, people talk about exercise and how important it is, but what are some of the benefits of regular exercise?
So there are a lot of benefits of regular exercise. I think many of them come to top of mind rather easily. Things like helping to manage our weight, helping to strengthen our bones and muscles. But I think there are also some other benefits of exercise that oftentimes we don't think of quite as easily. So things like helping to improve just everyday activities, how I can get up and down out of a chair, how I can climb stairs. The mental health side of it in terms of reducing stress, reducing risk for anxiety and depression and things along those lines. And also thinking about being able to reduce the risk of certain diseases. So things like heart disease and diabetes and certain types of cancers. So really there's just tons and tons of benefits of regular exercise.
So then with people maybe that aren't used to exercise and they've made this resolution and they're going to start and they're going to get into it, probably a lot of mistakes then that are made with something like that.
Oh, sure. Some of them is we just don't know what we don't know. But when it comes to those kinds of mistakes that sometimes we make, just thinking about taking on too much too quickly. So especially if we haven't been in any kind of regular routine, we want to be fit now. And so, it's easy to take on too much and decide I'm going to do all sorts of different kinds of things. And then when I have a bad day or it becomes challenging, I quit. And so that kind of ties into it. I think one of the mistakes we make is we just give up too easily. We quit too easily instead of having a little grace if we have a bad day or if we miss a session. The other things that I think of when I think about the kinds of mistakes that sometimes we make, not watching proper form in terms of how we're exercising, because that obviously is a problem in the sense of setting us up for injuries potentially. And then also sometimes leaving out proper warm-up and proper cool down. So our bodies are these amazing machines, and like a car, they work a lot better if we give them time to warm up and give them time to cool down. And I think it's easy sometimes to leave that part out as well.
So do you see patients then for exercise-related injuries at Fisher-Titus?
Oh, sure. We see lots and lots of folks with those kinds of things. Absolutely. Absolutely.
So how can somebody determine then what the right type and amount of exercise is for their specific needs and goals?
The best thing to do is to see a medical professional, whether it's your family physician or provider, or even somebody in the physical therapy realm. But a professional knows your specific instance. They can take into account the specific things about you. So things like medical problems that you may have, previous injuries, just your overall health and your overall activity level. So as a whole, the best thing to do is to seek out a medical professional.
So not to diagnose people, through audio here, but are there signs that someone might be overdoing it and might need to talk to somebody about it?
Oh, absolutely. One of the easiest things, I think, in terms of how do I know I'm overdoing it is just the fact that I get overly sore. So there's a certain amount of soreness that comes with physical activity, but if that soreness is lasting for long periods of time, if you're still having soreness, 2 days, 3 days after you do your activity, that's kind of your sign of maybe I'm doing a little too much. The other things that sometimes I think about are injuries. So if I am having injuries, that may be a sign that maybe I'm doing too much and my body is kind of saying,
So when you're doing all of those things right and you've got the right amount of soreness and you're not getting any injuries and stuff, sometimes it can still be hard to stay motivated and stick with that. So what are some strategies then that people can use to stay consistent with an exercise routine?
If there are ways that you can incorporate activity and exercise into your day, I think that works for a lot of people. So things like maybe when I park to walk into work, I'm going to park further away so that I am able to walk further and take more steps. Maybe as I'm watching television, I decide that every time a commercial comes on, I'm going to stand up and sit down and, go up and down the stairs, whatever it may be for each individual person. Some of the other things that matter is choosing activities that you like. So versus choosing the activities that you think you should like. So, whether it's pickleball or taking a walk outside or going to the gym, whatever it is, find the kinds of things that you like because you're more likely to stick with it and continue those things. And then the other thing is having some accountability. So whether that is having a workout partner or somebody that can be with you to kind of have a social aspect of that workout as well, or just finding ways, to keep track of your progress in some capacity. So whether it's a smart watch that can track, steps or calories burned or whatever it may be, but something that can help to keep us accountable and help us track our progress.
And then going back to talking about the injuries and overdoing it and things like that, how important is it to incorporate rest and recovery into your routine?
Rest and recovery is really important. And for a lot of people, including myself, it's something that I oftentimes overlook. But our bodies need that chance to recover and to allow things to repair themselves, as well as to help reduce our risk for injury. So, every 7 to 10 days, it's not a terrible idea to maybe take a pause just to allow our bodies to help resolve some of that discomfort and soreness, and also to give us a mental break as well.
So then if you have experienced an injury and you're talking about exercise and physical therapy, what actually is physical therapy, I guess, in relation to?
So physical therapy is a profession that's dedicated to helping people achieve their maximum function, whatever that might be. Physical therapists are kind of considered movement experts, if you will. That's sort of our niche. And so our goal as a therapy team is to figure out how we can help to improve your quality of life, whether that means get you moving more, helping to reduce pain if you have any of that, and also just kind of helping to develop those fitness and wellness programs to allow everybody to live healthier lifestyles.
So a physical therapist could essentially help somebody just starting to exercise. It's not just helping somebody out who's experienced an injury and is trying to start moving again.
Absolutely, 100% yes.
All right. So can patients see a physical therapist without needing any type of rehabilitation or therapy?
They can. So, as we see clients, oftentimes the clients that we do see are folks who are recovering, but we certainly are able to see people on the wellness track as well. So you can come and see a physical therapist and have that therapist kind of go through an assessment where we interview you and find out specific things about you, things like your medical history and your prior level of function, what your goals are, what you're wanting to achieve. And then along with that, we do an examination. So we'll take a look at you from top to bottom to look at how is your mobility, how well do your joints move, what does your strength look like, what is your balance like. There are all sorts of things that we can look at, and then based on all of that, we can put together a customized program for you.
Wow, that's really great. So if people want to get started with this and they want to talk to a physical therapist, where is the best place to go to get more information about this?
So there is information related to physical therapy locally here on the Fisher-Titus website, and you can find that at fishertitus.org/rehabilitation. You also can learn more about physical therapy and if it's right for you as it relates to starting exercise by talking to your family provider.
All right. Well, Jen Oakley-Swartz, physical therapist and manager of rehabilitation for Fisher-Titus Medical Center. Thank you so much for taking the time to chat with us today.
Thanks for having me. Appreciate it.
You've been listening to Wellness Prescribed with Fisher-Titus Medical Center.